Thank you, everybody. And this event, by the way, is on LinkedIn Live and Zoom webinars. I'm not too sure if the LinkedIn Live audience is seeing us and hearing us yet. So we're going to give that. Sometimes there's a little bit of a delay. I'm going to be bringing on the first speaker soon. And I'm going to introduce. I'm Jose Garcia and my co-host Ruben, and and this webinar topic, it kind of came to us from the previous events, and I was speaking to people who attended the webinar. So you got to talk about partnerships with public sector. You got to do that. You got to do that. So we get most of the ideas for our events from the audience, and which kind of keeps us in sync. And now, Ruben, I think you said this was a subject very, very interesting to you.
Yeah, because I think the important part, if you look at the healthcare, there are two distinct sides, if high level, because a lot of the developing nations and all that, they focus on public, healthcare, public thing, and the developed nations go or private part of it. But that collaboration, it's what makes a lot of these development and all that. And now coming into AI, so it's just so many of these, how these can work together, because that is where Miller and I've been talking about, and Miller has been doing amazing job on that too. How do we get, like, when you say public, we will define those, like it could be UN, it could be various non-profit and all that. How do you pull that one into this private? So it's a very interesting topic. And I would also later, we will talk about some of the cutting edge, investment technology I work with here. Everything starts with public somehow. People don't realize that it's not private, and then they go into how to monetize, how to do that. So it's a very important, intersection, in my opinion.
And just so everybody knows, this is a 1 hour event. And if you're in the LinkedIn Live audience, the event ends in 1 hour. But we're actually going for another hour. We're going to be conducting an after party. After all the speakers have spoken, we're going to handle some of the questions during the event. We won't get to all the questions. We go to an after party, which is 1 hour long, and that is on Zoom. And the reason why it has to be on Zoom is if you're in the LinkedIn Live audience, we can't give you the microphone. We can't bring you on camera. You need to be in Zoom webinars so we can do that. And that's what we do in the after party. We share out the microphone and the camera. Not everybody wants to speak on camera, but some people some people come on camera and bring on the panel. Some people just say something on the microphone to kind of go beyond just leaving a question in the chat and actually having a little bit of a dialogue.
So, I think that is a part, Jose, we have been very successful, because this is, I think, 15th session. Over time, speaking to people, from speaking with people, now speaking by people. People come in and contributing, and some of them become the panelists for the next one, because we pick these people who have conviction and good ideas. We bring them back here too as panelists. So it is interesting the way we have evolved, and it has been tremendous interaction from the audience, and that is what I enjoy on this, more than us speaking to them coming and providing those problem they are facing or the solutions they are already working on.
And I've just got confirmation we're live on LinkedIn. So I think we should. Now's a good time to bring on our first speaker, John Paul.
Hello. Good to see you.
Good to see you, John Paul. John Paul's joining us from the United Kingdom. And John Paul is why are we doing this event? Why is it important?
You want me to start? That's
yeah.
me in. So I think it's so salient right now because we're going through. Sorry, I should explain who I am, what I do. So I'm John Paul. I'm a management consultant who've worked in healthcare and retail manufacture for 10 years each, and I'm passionate about bringing those skills together alongside community health, public health. How can we kind of partner up private care, use that innovation with traditional healthcare alongside communities and patients? And you'll see why that's important, so salient right now as I talk. So we're going through a crucial turning point in that relationship, the traditional relationship between healthcare and technical providers. So up to recently, it's all been a very rigid relationship defined by contracts, which basically, to all intents and purposes, the tech providers meets the specification, gives the provider the tool, and implements it, and then the two almost part ways. There is often a little bit of a service agreement, but often the costs of changing things are prohibitive. Trying to get agreement between the clinicians and the tech provider takes forever. Approval processes take forever. So you have these kind of complete divergent areas of expertise that are not really working to each other, because the provider is usually going to get more money, the tech provider is going to get more money, just go on to the next client, next client, and next client, rather than servicing the cost of the original agreement. But with the way that technology is changing, so it's more service oriented, and we've got AI which is learning all the time, it completely changes that relationship on its head. It's no longer enough to go in and just provide the tool. We have to have ongoing management of the tool. We have to work with clinicians, and now increasingly we'll have to work with patients who will also be using the tool, will also be impacted by these tools. And so we have to kind of change our relationship, so we're having this partnership relationship, so it's a service relationship across the system. And that's very, very difficult because the perspective of clinicians and healthcare providers and the expertise they have is very, very different from the perspective of technical providers, and very, very different again from patients. So, but nonetheless, we have to work together. So after you kind of gone through the kind of doors of actually getting your technology approved, it's like you're confronted by this problem of people. How do you get people working the technology and getting the best out of both worlds? And the idea really that I'm passionate about is creating a learning environment, both for technology and people, to work together, to build that partnership, to build that harmony. So we're, rather than kind of staying in this stuck place where we're conflicting with each other, we're actually building on each other's expertise, building on each other's knowledge, so that we can increasingly improve as we move up forward in the future. And that also creates an environment where whereas traditionally healthcare providers, almost everyone you meet in healthcare will tell you horror stories about tech and how things don't work. And the classic thing is the one size fit no one solution. They're forever clicking through screens. And tech providers will go, oh my God, all these clinicians, all these managers can't get anything approved, takes anything to change. And then patients are going, well, the systems don't work for us, or we don't understand. It's too much information. It's not user friendly. We have to kind of start bridging those gaps. We have to start creating momentum. And something that I would ask is, we spend all our, and what actually, so what happens if we don't, is that it becomes a functional relationship. It comes, I need this, give me that. And it comes kind of a plain, withdrawn, people aren't really understanding each other, and it creates failure demand, where people going around the system can't get the problem solved. The provider doesn't know what to fix or how to fix it. It doesn't have the relationships. And so you end up with distrust. And a lot of your previous calls have talked about building trust. And actually, what I would ask is, like, how much are you investing in the relationships? How much is your organization investing in relationships? Not just doing tasks, but actually getting to know your customers, actually getting to know your providers, and saying, what do you want? What do you want? How can we work together in future? What can we build together? What's possible? What isn't possible? How can we move forward? And I think that's what I'm passionate about, creating conversations about. But you have to recognize we're not there yet. We're a long way from there yet. And just to kind of just give a bit of overview where we're really at, is that healthcare providers, there's a feeling amongst IT professionals and technology, and even communities, they're slow, they're inefficient, they don't work, they're rubbish, basically. And that's the narrative of the media. You go into an A&E ward in a hospital, you see how well they work. When someone's at death's door, them all combining. It's like the SAS, it's this really incredible stuff. These are real experts, and you will never meet so many experts as you meet in healthcare. They're just full of experts. And that's a little bit of a problem because they don't want to share that expertise. They're in response for the patients. They have a duty of care. Anything that happens is their legal responsibility. They don't want to share that power. And I think that's the problem that IT professionals have and patients have with healthcare, is like they're very paternalistic and they don't want to share. And there's good reason for that. But you've got to remember that people who work in healthcare, they're most senior people who've worked there for 30 years. And they know people, they have these strong relationships, and that's what they base their decisions on. So they see these IT professionals come in saying, you don't know anything, you're getting it all wrong, you're inefficient. And guess what? It puts their back up. And they're the same people who have to prove everything. And they've got to make sure that it's safe for their patients. And so on the other hand, we've got IT, which is kind of move fast, break things, disrupt. That's not what healthcare wants to hear. How can we make it safe? And how can we kind of manage the complexity of healthcare and these relationships and make it simple for patients? Because I think the danger is that patients are often left out of conversations because they don't understand what's going on. And that's just with healthcare. You add technology on top of that, you might have 100 different options, all with different codes. How does a patient know what to do? So we've kind of got to smooth the technology for the patients, but also do it in a way that makes the information flow around the system, helps the technology. It's information technology, so information should flow around the system, giving people the right information to make the best decisions at that time and not overwhelming them. And then there's another factor, is like, we've got to think about the jobs we're creating for people. If you're creating a load of work that looks simple, but actually it's someone ticking boxes all day, that's very unsatisfying. Well, guess what? They're going to be unmotivated and they're going to make mistakes. So we've got to use the technology to be satisfying, to create an environment that people want to work in. And at the same time, we need to connect IT providers with the impact of their work, understanding how their work connects to real people's lives, the difference they're making, because that will drive their passion as well. It's not just a cost. It's not just a little thing to do. You're making a difference to people's lives. So by connecting those dots and seeing the impact of our actions, connecting the feedback loops, we can actually create a system that helps move us forward.
Yeah, I mean, I think, John, you hit it, a lot of the challenges and how do the technology coexist with that. The one other point I got from you and some of the earlier webinar we were doing, the same thing is, how do you convince these, providers who've been working for 30 years, this technology is going to not displace them, but enhance the services and provide them value to them as an assistant rather than a replacement kind of thing. And that is a conversation to convince these people. I mean, how do we go about having that kind of conversation with the providers who are saying, oh, I'm scared of technology, or I'm worried my job may go away? And how do you balance that with these people? You know what I mean?
So something that most people working in healthcare recognize is when you go with any innovation or any new idea or anything different, or you're just a new person on the block, the first thing they do is give you a kicking. They want to test your mettle. And if you fold then, if you show you're just kind of apologizing, not defending your ideas, not explaining what you're doing while you're doing, they won't trust you, because if they're going to just have that salesperson tell me everything's fantastic, I'm not going to trust them. You have to be upfront. You have to be honest. You have to be saying, well, this is something that works. You've got a good point there, and actually build up that, you all respect their area of expertise, but at the same time, bring yours to the table too, and create that kind of, you do this, I do that, and build that trust. But also you have to prove it. You can't just kind of ignore problems. You've got to be responsive to their needs. And if you do that and make yourself useful, they will actually respect the fact that things don't always work if you're willing to listen to and work with them. And fundamentally, at every stage, it's all about making sure people are valued, listened, and heard. And what we can't do is let technology just do all the listening. We have to do it in person, because people need another person listening to them, nodding their heads, showing that they've been understood. Then we can bring the technology in. But if the technology is just collecting information, 70% of your customers are unhappy. Well, that doesn't tell you much. And
yeah, for the audience, if they are taking anything out of this one, is the trust factor. I hear you. Yeah.
And it's earned over months.
Jose, you are on mute.
Oh, no wonder no one was paying attention to me. I wanted to say something. Sorry, I was coughing. Something actually that really struck me. I did some interviews with oncologists who are kind of at the forefront of AI transformation. There's two things that really struck me, and I want to bring them up because, John Paul, what you just said, one of them was there needs to be an investment on both sides. So this guy's a head of oncology, and he's bringing these initiatives. He's investing in the relationship. He's investing in the relationship. He needs the counterparty to invest in the relationship just beyond just selling the solution.
Absolutely.
Another thing that really surprised me, and this came from a clinical informaticist who's also an oncologist. He said he felt insulted. He said him and his colleagues felt insulted because the tech providers were making recommendations without factoring in their expertise.
Yeah.
And especially in clinical decision support, you don't know enough about the situation to be prescribing a course of action.
Yeah.
And you can't tell from this test result what kind of treatment to give this patient. So they found like a lot of the tech vendors, by acting out on incomplete information and assuming and telling them how to do their jobs, said they felt insulted, which I was like, I was quite surprised by that. And
but I think the number one thing is, like, I've got a post on this for a while back, is don't invade someone's territory. Just don't. Respect someone's territory and let them own it. And that goes both ways. You have to respect each other's territory. But I see, like, you do absolutely need a clinician involved if you're going to be working with healthcare. But if you bring your own clinician, one of the big mistakes I see make is that there's a clash then, because they kind of like, they're telling the other clinicians whose area is what they should be doing, and that never works. So you've got to build that relationship, you've got to build that trust, but also speak the same language. But don't expect it to happen overnight. It takes weeks and months to build that trust, build that relationships. And usually it means at some point going through a difficult time together. And it's when you come out of that difficult time, that's when you find the trust is there. And they will fix things for you if you let them, if they trust and believe and have faith in what you're doing.
Thank you. Now it's time. We're going to bring John Paul back for the Q&A. And now we're bringing on our next speaker. Now we start getting into the how, into the nitty gritty. Hello, Alex.
Good afternoon. Thank you for the platform here today. Really fantastic first conversation. I laughed out loud at the go on attack, John Paul. I recognised that. So I'm really thrilled to be speaking to everyone today about at the intersection of technology, healthcare, public and private sectors. And over the next few minutes, I'm planning to walk us through the opportunity and the hype and some of the challenges, but instead focus on how to achieve real sustainable impacts through, and John Paul is almost like we prepared this part, through collaboration and partnering and relationships. Okay, so just the three things I'm going to step through. Firstly, I'm going to get some...
So, Alex, can you introduce yourself first? Because I think you jumped into it. It'll be great for the audience to know who you are. So, if
absolutely,
you can
happy to do that. So my name's Alex. I run Achieving Action. It is a dedicated social care consultancy in England. My background is rooted in both private and public sector worlds. I spent 15 years as a professional consultant in some really big names and organisations. I've also held operational leadership roles in both public and private sector. And my background and experience and passion really is driving purposeful transformation through the use of data and insights. And I think that gives quite an interesting perspective on this conversation today. So I was going to get there, but I'll go back to the three things I'm going to step through. The context, first of all. So I'm talking about adult social care in England, but I think that the approach is common outside of that particular context. I'm going to introduce a case study, which I think acts as the proof of how to use existing data to help unlock the investment in AI and new technologies, drive common purpose, and to John Paul's point, build relationships. And I'll talk about the opportunity, why we need to do that now. My goal really is to leave everyone with three things: a renewed sense of optimism for really what is possible out there, some specifics on how those relationships can be truly established, and also that tenacity. Let's get back out there. It is hard. As John Paul said, we get shot at a lot when you're trying to introduce something new, something disruptive, even though we know deep in our hearts the impact that this could have. So ever so briefly, social care in England, or ASC as I may drop into, it is distinct from the National Health Service or health in wider. So the NHS focusing on clinical health, diagnostics and treatment. Social care is run by 153, adult social care I should say, is run by 153 local government organisations. It provides on non-clinical care and supports, adults with physical, learning, mental disabilities, as well as older people as well. And the sort of support that is provided covers a really wide spectrum. It might be helping someone to wash and to dress, provide home care, supporting unpaid carers, or funding residential or nursing homes. So it's about support for living, independence and well-being. So you'll see it's related to health, not exactly the same, but the opportunity to bring these things together are really, really tight. Now, like healthcare, in social care, it is a system that is often driven by stories of individual needs, stories of expertise, and the services, which are often limited, analog or in-person services, they have been historically rationed by eligibility criteria. Yeah, that's how it is distributed. So with all of well-publicised financial challenges, additional demands, complexity and expectations, the pressure on that system is huge. And what it's meaning is that the skills and ways of working from other sectors, and indeed from the private world, are really now required to introduce new ideas, new service innovation, ways of working, new technologies, including AI, specifically, and also specifically to value the numbers and facts to bring in these new ways of working. So the core part of my message today is all partnerships work best when you've got a constancy on the vision, you have a shared data-driven prioritization of action, including new technology and AI, and this is no different. And what we need to do, and I would encourage everyone on this call to do, is to see it's on us. It's on us to bring these two perspectives, the human stories and the hard data and evidence together to create that purpose. So I'm going to jump into the case study for this. So a private startup, I'm not going to name them on this call presentation today, but a private startup was delivering a digital support platform of loads of different online functionality to unpaid carers. It's different from an in-person service because the support is available 24/7. It's available at the weekends. It might be when you're least expecting to need support, it is instantly available. And they are injecting this new scalable ways of working into a service area previously dominated by finite in-person services. Now, they know and knew that their service was having real world impacts. They would get testimonials, feedback, reports from carers telling just how transformed their lives. It's made their situation bearable rather than unbearable. But they were really struggling to articulate in a way that would secure the right investments for growth and even in some cases renewal of their services to take those forwards. And this is where the power of data partnership comes into this. So we worked with my small mission-led startup business. We worked with them to translate their services story into a balanced value statement using existing data. So the existing data that was already being provided, we supplemented what they already had: descriptions of functionality, features, good news, care anecdotes, and we could draw direct evidence from what is at the moment really fragmented data in lots and lots of different places, but available, and we pulled it together to compare and contrast how organizations had operated before they had the service and how they were operating afterwards. And by doing and comparing, I should say, to clients who didn't have the service, where are their trajectories? Where are they going afterwards? Again, so this was using existing data provided by potential clients or existing clients to look at comparisons, direct comparisons, against some of the key areas that the service added direct value. The 3 dimensions came out by doing this. We could see the fiscal sustainability. So this focused on the commissioner needs. So the data showed that clients, local authorities, could support a higher proportion, more people, more carers who wanted and requested support, despite reducing the overall spend on carers. And that the service was also supporting lowering or delaying of long-term care packages for the cared for that lasted for longer than 12 months. So financial lens, we began to have some evidence and insight to focus on. Secondly, service excellence. So the frontline challenge, instead of the needs or for people to contact the social care teams from the community, you saw a reduction in the routes for people, how they're entering social care. They were coming from other angles. It's not a digital service. It wasn't going to prevent falls and things like that. But you could see that there were fewer requests for support from the community coming through. So that helped the frontline needs. But also, really importantly, you could see the impact for your principal social workers on the impact for the carers themselves. There is direct linkage between carers' ease finding information about services and level of social contact. These are measures that are tracked nationally. Clients with organizations who had my client service demonstrate insignificant improvement and outperformance against these measures. So what we could do is a balanced scorecard using existing data, which helped to bring to life the evidence base to secure that investment. I won't go so much into the challenge, because I think, John Paul, I love what you were talking about there, but I will just make one extra build, which is in social care, and I think it's the same in the world of healthcare, the use of existing data is random, it's sporadic, and it's fragmented. It appears to be used to create a particular answer to a particular problem and is then moved on again. And I think what that gives us is a real problem. We could just throw our hands up and say, let's not use it. And you also often see individuals say, oh, don't trust the data, it's not right, it's deficient, those guys use it differently to how we use it. It's a really easy way to get out of looking at the data and to discredit it. But this is the same data set being tracked for long periods of time. It's relatively consistent, and there are hundreds of data points. So our point is there are some which are valid, some which are less valid. And it's about actually unlocking that and illustrating how a balanced scorecard can make a difference. So, final points, in terms of partnering with intelligent technology for the effective productivity gains, intelligent technology is not just a tool to automate, it's a way to release capacity and to partner better human to human, in my opinion. So intelligent technology is the opportunity to springboard or turbocharge productivity, a phrase we hear a lot about. We need more productivity, but in my language, effective productivity. So the maximum possible outcome is being delivered from the available investment. That should be the focus. That is the unifying agenda. In the private sector world, what is your GDPR outcomes at the end of the year? In the public sector, it should be, what is the greatest value that we're having for the investment applied? If you can do that, and these are the critical when you're trying to balance increased demand, volumes, and accuracy of need, and forecast future, and resource and spending aren't keeping up. There is no other way in which to do this. So our aim is to harness the strengths of both technology to process vast, fragmented data sets, identify patterns, and the human's ability to interpret, to listen to John Paul, to compassion, to innovate. Those two things need to come together. So that's what I'm going to pause it there. And I hope that was answered a little bit the how question.
No, I think, Alex, you articulated quite a bit from, I see this kind of approach where, if you look at the older technology and the medical evolution of the medical thing, it is a lot of education and just reinforcing what the research has given and everything. The new dimension we added with the technology and the data driven algorithm, it is changing that, as you mentioned, it is so much, discrete and different value and all that. The challenge which we continue to see, I think it is improving, is how do you bridge those people like John Paul's talked about, 30 years of experience people, they go by these Bibles or books they have written about all this, versus the new data, which is providing how human interacts, how human trust, how we do that. And that bridging is an interesting point I think you are bringing up. How do you bring that trust? Yeah.
We need to bring on the next speaker. I will make a comment. This is not a question. You know what really struck me, Alex, listening to your, I don't know your world. I'm kind of new to that. It really reminded me of pharma price negotiations, where it starts with the story. Great, you've got this new cancer treatment. Great, we like it. But if we go through the numbers, will we get the same results? Mm-hmm. Will it support? And that's a critical step when you're going to get access to a public sector purse. And thank you so much, Oz. We're going to bring you back. And Sarah, now Sarah's spoken, I think you spoke in a webinar 2 or 3 webinars ago.
Yes, I believe I did. Yeah.
And,
it was really good.
Back then we were talking about preventative health. Now, and actually this almost dovetails what we were talking about before. We're going a little bit deeper. You did touch on landing and expanding the public sector. And I think there we were talking about prevention. And by the way, can you introduce yourself? Because I think half the audience know you, the other half don't.
Yeah, of course. So my name's Sarah Bundy. I am a business consultant working in the digital healthcare sector. I've worked with the NHS and global care providers in both public and private sectors for about 10 years, 11 years. Absolutely flown by. And my main sort of role is looking at ways to improve patients' access to healthcare services using digital technologies. My experience actually runs from patient appointment booking apps to CKD diagnostic tools, mental health solutions. And my ethos, my drive is to provide access to the right care at the right time, with the goal of improving outcomes and using data prevention rather than cure when possible. So that is my intro. And I think what I'd like to touch on today would be the advice that I'd give technical founders in terms of how do they communicate to someone in the public healthcare sector in the crucial first meeting, and also obviously very important, what does success look like? Because I think many of us have been on meetings and thought, wow, this meeting's gone really, really well, great, and then you don't hear from people again, or they throw curveballs at you. Because I do think that sometimes technical founders often struggle not with what their product can do, the product set itself, but actually how to communicate and why it matters to people in healthcare who sometimes have a very sort of different frames of reference. So I think when I'm sort of meeting with people for the first time, I do like to understand the context before I speak. And healthcare professionals think in terms of populations, outcomes, evidence, rather than glossy features, tech stack, isn't this app pretty, that type of thing. So before the meeting, and this is key, research their mandate. Are they focused on prevention, access, data, cost reduction? Understand their incentives. So public health leaders will often measure success through outcomes like reduced hospitalizations, for example, screening uptake, not just revenue and efficiency alone. Learn their language, talk in their language. And if you don't understand something that they're talking about, ask. It's always the best thing to do is ask. So they will talk about health outcomes, interventions, data governance, health inequalities, which is massive. Don't throw buzzwords at them. really don't, unless they ask. So, there could be stuff that's on trend, talking about, AI, that type of thing, obviously, but stick to their language. Translate your tech into their world. So as an example, our model identifies high-risk patients. We help you allocate scarce resources to populations most at risk, improving outcomes whilst reducing operational burden, as example. Lead with the problem, not the product. If you can, it is very difficult to get caught in this trap. If you're excited about something, you think it's the best product in the world, you'll actually earn credibility faster if you start with a shared pain point rather than a demo. So frame the conversation, start with the why. We've seen that the local health authorities struggle to offer enough primary care appointments. We wanted to explore how our technology could make that easier for you. Ask for their perspective. Can you tell me how your team currently address this challenge? And then only introduce your solution into response to what you've heard. Then you can talk about outcomes and impact. So emphasize this. Healthcare leaders want proof that your innovation can move the needle on outcomes, not just automate the process. So you can say something like, our platform reduces manual data entry by 80%. Try something like, our platform gives cardiologists real-time data visibility, cutting reporting delays from weeks to hours, which means faster outbreak responses, as an example. Bring the metrics that tie public health KPIs. So reduce disease spread, improve screening uptake, better data, interoperability, which is a key thing, especially when you're talking about healthcare and social care within the UK. Interoperability is key, making sure that the clinicians have access to the right data at the right time, and that is key for providing healthcare to the citizens and people within that world. More equitable access and better allocation of resources, and demonstrated cost effectiveness or time savings. And again, I think we've touched on this as well. So building trust and not hype. So public health leaders are used to vendors overpromising. And I think, again, we have touched on this. You'll stand out if you're transparent, being truthful, acknowledge your limitations openly, mention data privacy and security early, and don't oversell. Instead, invite collaboration. So we'd love to pilot with you. We can do a co-design. We can do an evaluation framework, that type of thing. And I've worked on that type of thing in the past, and proof is in the pudding. I know that's a cliche, but if you offer a pilot at an early stage, it really, really does build trust. And then you can start getting some early data. And then off the back of that, I think define what success looks like in the first meeting. So what I mentioned at the beginning is you walk away from the meeting and you think, wow, that was a great meeting. Well, what does success look like for you? It isn't just closing a deal and earning curiosity and next steps. It's they're engaged and sharing their own challenges rather than just listening politely. You shift from presentation to collaboration. An example would be, how could we adapt this for your workflows? And then you agree a concrete follow-up, such as a pilot discussion, technical deep dive, or data access review. And they introduce you to other stakeholders. So again, that's a massive thing. You could talk to the data governance lead, medical officer, that type of thing. So again, this sort of really moves along to the next steps. And I think if you understand in your mind what success looks like, I think that will really help you to engage early on in a better manner. From my personal experience as well, and also use, as I said before, your language very, very carefully. So try using public health language rather than technical founder language. And I can go through this in the after party. We can try something, and we can try sort of, what the differences would be. Might be quite fun, actually, Jose. That might be something we could do. But yeah, that's my take on what success looks like.
Yeah, Sarah, I think you hit that right way of the collaboration word. I mean, we talk about trust earlier. Then the second part of it is how do you collaborate? So when you mention that collaboration side of it, because when I do technology sales in big enterprises, you find some technical buyer who will do collaboration of understanding and how they are using it, how our solution will fit in. Well, in the medical field, there are discrete people. There are IT people, there are providers, and there are doctors or is experts, and then economical buyers. When you talk about the collaboration for them to talk to you, who are the people you are thinking of? Because a lot of audience in our people are actually will be entrepreneurs, budding entrepreneurs coming from the technology angle, and your expertise in that would be helpful to say who do they should in the audience pick them to do a collaboration or demo or something together.
Yeah, so in the past, how it works within the UK, you have commissioners, so you have people that have the authority to spend government allocated money, for example. So there could be a pain point, reduction in hospital admissions, the amount of patients that aren't attending primary care appointments. So they're called DNAs, they do not attend. So how I've approached this in the past, I've worked with the commissioners, understood what their budgets are, and that their budget actually covers this particular pain point. Then you need to work with all areas of the health ecosystem, because the commissioners can pay for something, but it doesn't necessarily mean it will be used, which is a massive problem in this country. So they can spend the money on whatever they want, but the GPs, the practice managers haven't got to use it if they don't want to. So from the start, getting the buy-in from everybody and finding out their pain points from primary care, from the patients. So meet with the patients, have patient forum groups, understand what their ecosystems look like, and then you develop the pilot to work with everybody. So not only from the commissioner point of view, so the high level C-suite people that are paying the bills, all the way to obviously the most important people are the patients. Let's not forget that. But the practice managers, and they're sometimes known as the gatekeepers. They're lovely people, but they have a job to do. So work with those guys, work with the GPs, the doctors, work with the practice nurses. So it's really, really important to get everyone to buy in, and then the data can be given to everybody. You can share that with the nurses, the practice managers, and all the way to the commissioning groups. This is what our product's going to do for you. It's going to save you X amount of money, because for every missed appointment that costs the NHS £25. But when you flip that and you're talking to patient groups, this product is now going to allow you to get access to more GP appointments, because more people are cancelling as they should do, therefore freeing up more time for the doctor to see you. So that's when you need to know your value points when you're speaking to different people. But it's very, very important to get the buy-in from everybody at the start and work with them and be open about what you're doing, why you want to collect data. It shouldn't be, well, the commissioner's paid us, we're doing this, and we're going to work with you. They'll shut the door straight away. You have to be open and honest and transparent with why you're doing things, and then ask for input. What else could we do to help you? And then you can take that back and go to the commissioners. Actually, we've had 25 GP practices within this area have said that they want video consultation, as an example. And I give that as an example because that happened and we did it and we launched it and it was great prior to COVID, which was quite handy and very unfortunate. But so for me, it's understanding all the layers. I think any health ecosystem is like an onion. You have to peel back each layer and understand what you're working with. If you don't, you'll cry, because onions can make you cry, right? So you have to know how to take them apart properly. But yeah, that would be my advice, is to find out the pain points, know the budgets, find out all the key stakeholders across all levels of the ecosystem.
Thank you, Sarah. And we're going to do that in the after party. We've already got, thank you so much. I'm going to bring on our next speaker, and Sarah will be back.
Thank you.
Okay, and Chime, welcome.
Thank you, Jose.
I think you spoke in the after party. Was it the last event or the one before that?
Yes, I did.
And I wonder if you can either
I'm fantastic. I'm really excited coming on the panel this edition. Last time I spoke at the after party, and it was quite enlightening. I've really been encouraged, and I've learned a lot from all of the speakers, and it's beautiful to know. So my name is Chimezie-Uche. I'm a trained physician from Nigeria, but I've fully transited into tech. So I'm more of a health tech innovator and an ecosystem builder. I've been in the health tech space for well over 2 decades. I've supported a few startups. We've done we've built innovative solutions in Nigeria, which I know is solving similar problems across Africa. Today I'll be talking on building equitable MedTech partnerships. I'll be coming from the African perspective in public-private co-development. Next slide, please. I won't waste our time. Since I got 10 minutes, I'll do this in a rush, but I'll make sure I hit the main points. Okay, that's me, and that's my contact. Some of the challenges I'll be sharing this evening is across Africa. It's similar across Africa. But again, I won't share. We can go to the next slide, Jose. But again, I won't share problems without talking about their solutions. So I mean, across continents, we speak about AI, MedTech, and the power of partnerships. But what truly transforms healthcare is not just technology. It is collaboration that understands context. At the last African Health Tech Summit, we realized that it's not just collaboration, but it should collaboration. So collaboration shouldn't just be a buzzword, but there should be full action following. I mean, that's where public-private co-development becomes a bridge, not just between sectors, but between ideas and impact. Yet, true impact comes when innovation aligns with local systems, real patient needs, and inclusive governance. So, I mean, I'll be taking a reality check and seeing some of the challenges and how we overcome them here in Africa. Next slide, please. So that's about my journey through innovation and collaboration. A bit of more background about myself. I won't fail to mention that I co-developed what is known as medical collaboration services. It's a unique PPP arrangement that is helping us solve a lot of the PV challenges in Africa, which we can also domesticate across African countries. Next slide. So I'll look at the African Health Tech Contest. Next slide, Jose. And I'll look at the progress we've made so far and the promises. All right. Africa is not just a technology desert. It is a testing ground for resilient innovation. I mean, if you follow a couple of the innovations coming out from Africa, from InsurTech, from across fintech solutions, you agree with me, M-Pesa in Kenya, Eden Healthcare in Rwanda, and what we are doing presently in Nigeria through Great Care, you realize that, look, we are building resilient innovation from AI-enabled diagnostics to mobile health tech insurance innovators. We are reimagining access to care. For us, everything we do centers around patient care and how patients can access quality care and even making care more affordable. Okay, but building MedTech AI solutions that scale requires ecosystem maturity and alignment between innovators, inventors, and institutions. And that alignment is where we still have some growing up to do, not for lack of talent, but for lack of trust, clarity, and continuity. Next slide, Jose. Now I'll do the reality check. Why code development often stalls in Africa? I'll be looking at the distance between innovation and implementation, and that is not always technological, but it is structural. Number one, there is still the bureaucracy of process. So I'm bringing up the challenges. I mean, approvals, there are still paperwork to be done. There are still paperwork being done across some ministries and departments, and overlapping agencies slows innovation. Many African founders still spend more time navigating systems than building solutions. Next, I'll look at the policy volatility and, of course, political turnover. A new government can end a promising health tech partnership overnight, not because it failed, but because it is seen as a legacy project of the past administration. I mean, this kills a lot of innovation. Next slide. I'll also talk about what I call the gatekeepers effect. I mean, access to decision makers is often layered with political intermediaries. In Africa, we still have PA to SA to SA. I mean, it can be humongous. By the time a solution gets visibility, momentum and investor confidence is lost. And lastly, I'll touch on misaligned goals. Government focuses on visibility many times, and this risk reduction. Innovators focus on agility and impact without a shared language of collaboration, partnerships loses reading. And that is why the last Africa Health Tech Summit, I started talking about private partnership and not just a private-public partnership. Let's look at the human face of innovation. Next slide. And I'll tell a bit about the great case story. All right. So when we talk about MedTech and AI, MedTech AI, let's remember that let's remember the faces behind the data. At GreyCare, we are building an AI-supported ecosystem for elder care, connecting families, caregivers, and clinicians through home-based health support. And I'm privileged to lead that team. The insights we gain from thousands of elderly interactions help predict health risk early, prevent hospital admissions, and enhance quality of life. It's proof that when AI is localized and humanized, it becomes a care enabler, not just a tool. So for us, in the GreyCare family and a couple of the beneficiaries we support, we know that AI is not just a tool. On our caregiving service platform at the moment, we are integrating what we call automated caregiving matching. So you don't have to spend time looking at which caregiver you need. Or once you impute symptoms for the elderly loved one, pronto, it narrows out like 2 or 3 caregivers you can pick based on experiences, expertise, and a whole lot of others. Next slide, please. Now, what's the way forward? Like I said earlier, I don't think I'll come here talk about do reality check and center on the challenges alone. Now, I'm thinking we should move from PPP to co-development. All right, so we should move beyond contractual partnerships to co-created frameworks where both public and private actors design, test, and scale innovations together. This should begin to happen across African countries and probably across other Asian countries and all over the world. Second, we should consider embedded policy innovation. Government should now start acting as enablers and not just regulators. In Africa over here, government's actions and regulators are more like witch hunting or teacher-student relationship. I mean, we should tone down on that. We should see governments should come up more as enablers and introduce innovation sandboxes, safe zones where health tech solutions can be tested with defined policy boundaries. I mean, it's not, it's a known fact. Government own the users, government own the citizens, government own the population. So if I design a solution today I want users to use, if I partner with government and government is truly an enabler, then I'll get more people to use it. All right. Third, like I said, we should be rethinking co-development for MedTech AI. Third, we should start building neutral ecosystems, shared infrastructures like national digital health layers, open APIs, and unified EMR protocols, which allows multiple innovators to plug in, reducing duplication and encouraging interoperability. I must admit, this is already existing, but then we need to do more. I mean, the discussion surrounding interoperability of systems is one we shouldn't stop. These should be conversations that should be on front burner. And lastly, shared risk and shared reward. Investors, governments, and innovators should adopt blended financing and outcome-based funding models where success is measured not by paperwork, but by patient outcomes. I mean, this will help tone down a lot of pressures on healthcare innovators like myself. All right, and then we can take it up from there. Next slide, please. So I'm going to be considering why co-development must include AI ethics and local intelligence. I mean, we've agreed that AI is not just a tool, so we can further say AI is only as ethical as the data is trained on. In Africa, where health data diversity is limited, co-development must prioritize data sovereignty, inclusivity, and contextual intelligence. I mean, this is a no-brainer, right? This is how we should co-develop and implement whatever AI tool we need to implement, or whatever frameworks surrounding the deployment of any AI solution. All right. So AI in healthcare must not replace human wisdom; it should amplify it. I'm rounding off. In 2 minutes, I should be done. Next slide. So we should look at towards a collaborative future, and like I said, one that is not just heralding the collaboration word as a buzzword, but one that sees collaboration and pushes it towards action. So co-development is not a charity from the public sector. It shouldn't be seen as charity from the public sector, nor an opportunity from the private sector. It should be seen as a shared responsibility for health equity. The future of MedTech AI depends on our ability to do three things. These three criticals. Number one, build trust across sectors, design for resilience and perfection, and nurture ecosystems that learn and adapt and not just systems that comply. All right, in closing, Africa's healthcare story is not one of lack, but of lessons. Lessons that can shape, next slide please. Africa's healthcare story is not one of lack, but of lessons. Lessons that can shape global co-development models if we listen deeply enough. The continent's challenges are real, but they also produce some of the most adaptive innovations in the world. Innovations and innovators in the world. What we need now is not pity, but partnership. Not parallel innovation, but co-created progress. Thank you, everyone. Thank you, Sam.
You know what? And actually, the word momentum keeps coming up in this event. And Ribbon, did you want to comment on that?
No, I think, I really enjoyed that the way you summarize and present it. Actually, we never had this kind of co-presentation while we are doing this one. I think that is new, and I enjoyed it really, because visuals always help better than just talking. Yeah, so a great job, Chime. And I think overall, I think we are trying to pin today. I think we should bring in Millers quick enough because we have enough time. But it is what you are saying, because the partnership, collaboration, and able to showcase the problem and the value, I think you articulated very well.